What disability insurance carriers don't understand about hidradenitis suppurativa and a disability insurance claim. Now, we know that HS is a very painful, unpredictable, and misunderstood medical condition. It can involve more than just a skin flare-up. It can lead to surgical treatments and being evaluated and treated by multiple specialists. And obviously can cause psychological distress. Now, despite all of this, I will tell you that disability carriers don't look upon these claims very favorably. And here's why, and here's how to fight back. There are no clear diagnostic studies. There's no one simple test that will result in a diagnosis. And it's really crucial that your physician is doing a thorough medical examination and are documenting the episodes that you're having, episodes of flares, and how long it takes for you to recover from these flares. But there's more to this. It's a question also of mobility, fatigue, because of the pain, and of course the pain. Those things are obviously subjective in nature, but they should be documented. Now, many times disability carriers will say, hey, you're recovering or you're in remission, and that doesn't equate to being disabled. So I want you to understand that, as you know, these flare-ups are disruptive and they're chronic and they're unpredictable, and the medical records should document this. One of the things you do need to understand is that some of these disability policies will have subjective medical condition limitations. And what that means is that they will only pay disability benefits normally for 2 years, at which time this subjective medical condition becomes effective. Well, some of these terms are very broadly written to include medical conditions that are painful, that involve fatigue, or maybe even limited range of motion. And they want to see objective basis, if you will, for these types of complaints. The other problem that we have in these types of cases are the mental nervous policy limitations. Normally, you will see in a disability policy a provision that says benefits are limited to just 2 years if your disability is caused by psychological problems. That's certainly not an issue in these cases because there's an objective basis here. But there's what I call the Monty Python mental nervous policy limitation. And it says, look, if your disability is caused or contributed to, regardless of how small, your benefits are limited to just 2 years. Now, you are legitimately depressed, you're anxious, you're embarrassed. But if that is a cause of your disability, benefits are going to be limited to just 2 years. That isn't to say that you don't have these problems, but your doctor has to clearly indicate in the medical records that your psychological condition is not contributing in any way to your disability. Got it? If you have any questions about your rights to your ERISA disability benefits, call us today at 727-894-3188 for a complimentary consultation. We can help you regardless of where you live in the United States and regardless of who that disability carrier might be. Got it?